Mr. President, I thank the Senator for answering those questions. I would like to speak to this bill, or really speak against this bill.
Senator has the floor.
Yes, sir. You know, I've listened to the discussion, and as a physician have kind of laid back and seen what everybody was saying. And, you know, on the surface, this bill is about abortion. But I would say that, speaking for myself and probably for a lot of other folks on this floor, nobody in this room would choose or like to have a woman have an abortion. So if we want to have the discussion of how to decrease the incidence of abortions, we need to talk about things like education. We need to talk about promoting abstinence amongst our children before marriage. We need to talk about access to health care and contraception for young women. But that's a discussion, obviously, for another day. But what I would like to do is just tell you what I think this bill does. And the first thing that the bill does is it tells or mandates a woman to have a diagnostic procedure, which perhaps is against her will. And as I spoke the last time regarding this bill, I really consider that, as a physician, unethical. And I know there will probably be some women on the floor to address that. But what I would like to address is what this is about for physicians. And it really is telling me, it's telling my colleagues how to practice medicine. And that's coming from non-physicians. And we talked about standard of care, Mr. President. Let me just tell you a little bit about how we determine standard of care. And by the way, that's used in a court of law. And standard of care is what a physician, or in this case a provider, would do that's acceptable both in the workup and the diagnostic procedures and the management of a patient across the Commonwealth. And we take that very seriously, our standard of care. And what goes into our standard of care, for me, Mr. President, I went to college, and then I went to medical school for 4 years, and then I had 6 years of training after medical school. I had 10 years, Mr. President, of training to be able to practice medicine as I do. We do not need, as a group of physicians, non-physician legislators dictating to us how to practice medicine. Mr. President, we have some issues with health care. I really believe we have the best health care in the world. We have issues with our system. That's a given. But as we try to bring or recruit physicians to the Commonwealth, how can we reach out to a physician and say, you know what, we'd like you to come work in my group, but by the way, we have folks in the General Assembly that are going to tell you how to practice medicine. That is not a way to tell a physician that has had the amount of training that I've had what they should and should be doing. I want to just, I guess, talk about what these bills do. The first version of the bill was bad enough. It told, as the senator from Chesterfield said, it asked or mandated physicians and their patients to do a procedure so that appropriate information could be given to the patient. And so then it was changed now to say that we are going to mandate you do a test, but we're really not going to let you do the test you need to do by this bill. We want you to do a trans-abdominal ultrasound when you know full well, as the senior senator from Fairfax just told us in the early portions of when women go in for this procedure, I might as well put the ultrasound probe on this bottle of Gatorade. I'm going to see just as much. So what we're telling doctors to do is to do a totally unnecessary test that's very costly at the end of the day. Mr. President, just in wrapping up, I think that, again, sitting here listening to the discussion, when we as a group of non-physicians start telling a doctor and a patient how they should practice medicine and the kind of medical care they receive, we are getting in way over our heads. It is time for us to get on solid ground and make this bill go away. I will tell you that this is a tremendous assault on women's health care. It is a tremendous insult to physicians practicing in the Commonwealth of Virginia, and I would recommend that we defeat this bill. Thank you very much, Mr. President.